And it was never told exactly what to talk about. And it seems that everybody's interest is in skin. And as plastic surgeons and dermatologists, we see people every day with all types of skin. Early on in my career, I was mostly interested in operating on the skin, and I still am, but I've seen so many different types of skin over the years that in reality, I have a much stronger interest in the quality of skin now. And you know, we've all seen babies, you know how soft and supple their skin is, it's smooth, it glows, it's clear, it's bright. By the time we get in our 50s or 60s, we've seen some changes, and it's a very slow, insidious change as we get older, but we get the fine lines, we get the deep wrinkles, we get the sunspots, we'll have the little surface broken blood vessels, hairs start growing where we don't want them to grow. You know, mustache hair is okay for a guy, but it's not so good for a woman. But we see all of these changes in our skin, and what's happened over the past 10, 15 years is that technology has really given us a lot of modalities to improve the quality of the skin. When I first started, we had lasers. We had CO2 lasers and erbium lasers. And some of you may have experienced those technologies.
Barbaric.
They were very barbaric. But what they would do is they would take our skin, which was already thinning, and it would burn off the outer part of our skin. It was almost like napalm across the skin. So we actually were helping people for a few years, but in the long run we were actually hurting them, get the same benefits without any of the complications. So now we have the Fraxel Repair, which is a fractionated laser which drills microscopic holes in your skin, and the ultimate benefit is that we thicken the skin, we tighten the skin, we eliminate most of the brown spots, and we can seal off those little surface vessels that irritate everybody. So that is really an incredible technological advance that was brought to us by the laser scientists. The other thing is that we know so much more about the skin now. For years, all of our efforts were directed at the fibroblast, which is the cell in the dermis that makes the collagen. And so we thought about the collagen, and that's pretty much all we thought about. But there's a lot more that we can do. We can alter the epidermis. We can cause the cells at the bottom of the epidermis to plump up like they were when we were children. We can cause the outer cells to flake off in just a microscopic fashion instead of getting that irritated peeling that you get with retin A. And if anybody's used any kind of retinol or retin A or retinoic acid, it's a vitamin A derivative, and it's very irritating to the skin. So you have to kind of hide its effects, its bad effects, in different solutions so that you get the benefit without too much of the negative. But we have new solutions now, new products which are now coming out. They're plant-based. They're safe. It's what's considered green technology, and we can get some of the same benefits, sometimes even better than the retinoic acid. And it's actually soothes the skin instead of, you know, there's the ground substance in the dermis. It's a hyaluronic acid. We can stimulate the formation of ground substance so we can plump up your skin. There are actually some new creams that are being developed right now, which within a couple hours of applying them to the skin, your skin actually feels better. And within 24 hours, it looks better. And within 6 to 8 weeks, you can see remarkable changes. And I think we're going to start to see a lot of these come out as people understand more and more about the physiology and the chemistry of the skin. What we try to do in the two med spas, we've got a medical spa in Fort Worth and a medical spa here in Weatherford, and we've really appreciated the warm reception we've gotten here in Weatherford. But what we try to do is we try to look at all the latest, most advanced skincare products. We evaluate them, we look at them first, and we try to eliminate the ones that have harmful substances in them, like the parabens and the formaldehydes and some of those other things, because we don't really want to be applying toxic chemicals. If you don't want to take it as a pill in your body, you certainly don't want to be putting it on your skin as a treatment. Even though it might have some benefits, we don't know what the long-term toxic effects would be. So we really evaluate the products carefully, and we try to offer things to you that are safe and effective. Now, another thing that's really been an advancement, years ago when I first started with the skincare clinics, which was probably 20 years ago, it was sort of a hit and a miss. We would take your photo, and usually the lighting was different every time we took the picture, and sometimes the camera was different too. And it was back in the early days of the digital cameras, so they weren't very good. But we'd take your picture, then we'd treat you for a while, and take your picture again, and then it was kind of like the emperor's clothing. We'd try to decide which was the pre and which was the post treatment, and then we'd tell you it looked good, and we'd try to keep you using the same product or move on to another one. But now we have the Vizia, and probably a lot of you have the Vizia done. I had the Vizia done about a year ago, I guess, and even though I've had a skincare clinic for 20 years, I've just been basically lazy. Taking a shower once a day was as much as I wanted to do, and occasionally I would shave if I had to see patients during the day, but if I was in surgery I wouldn't even shave. But I had the Vizia done, and I realized how bad my skin had really gotten. My wrinkles were at 6%, and if anybody's had a Vizia done, you know that the bigger the number, the better. Well, I'd rather have it 94%, but it was 6%. So I realized that just in the process of aging, I'd gotten a lot of wrinkles, a lot of UV damage, a lot of brown spots. So I decided to start a treatment. So I got onto the products, used them for about 6 weeks, did another Vizia, and there was a dramatic improvement. I was pretty impressed. And in fact, as we operated surgery, some of the scrub techs, because we're close around a patient's body operating, they started asking me what I was doing with my skin. And when anybody asks you, what are you doing with your skin, it's positive reinforcement, so you really get excited about it. So I've done 2 Fraxel restores now. I've got 11 or 12 more to do. Actually, 2 or 3. It's pretty painful. But, I'll do that as long as I can tolerate the pain, and then I'll get back on the products. But it behooves all of us to really try to keep our skin looking healthy. As the economy is not so good, it's pretty good in North Texas, but a lot of people are going to be working longer, they're going to be in the workforce longer, and there's more people competing for the jobs, and so they're really, we've got one set of skin, and if we can protect it from an early age and just keep it as a good quality skin all through life, we really truly benefit. And I'm sorry that I didn't do this 20 years ago, because I've had this available to me, but laziness is something you can't really do much about. But I'm very aggressive to all of you, is that you really should protect your skin from the sun. There are 3 things that affect your skin the most. One is genetics, and there's really not much you can do about that. I sometimes see patients in the office who look like they're 50, but they're 80 years old. And then I sometimes see patients in the office who are 45 or 50, and they look like they're 80 years old. And I always ask the older people who have good-looking skin what they have done to protect their skin. And every one of them says nothing. Basically, they tell me that one of their parents had really good quality skin. And that's all genetics, and there's nothing we can do about our genetics. But the other 2 things that really affect your skin are the sun and smoking. So if you can quit smoking, because smoking kills. There's no way to get around it. It kills your body and it kills your skin. And a few years ago, a British physician described what is called the smoker's face. And it's a series of things, and if you read about it and you look at somebody who's a smoker, it's dead on. It perfectly describes what a smoker's face looks like. The other thing is the sun. I mean, there are simple things we can do. There are new FDA regulations for sunscreens, and you should always get a broad spectrum, UVA, UVB, and get a block instead of a screen if you can. Get something that's hypoallergenic. Nowadays, the sunscreens are supposed to say that they're water resistant either for 40 minutes or 80 minutes. So clearly it's not a one-time-a-day application and then go on about your business all day out at the beach. So it has to be reapplied. You should try to avoid the sun between 10 and 2 in the morning, 10 in the morning and 2 in the afternoon. And if you can, wear a broad-brimmed hat to kind of keep the sun off your face, your neck, your back of your ears, and that sort of thing. As plastic surgeons, we see a lot of this time in my practice, after 25 years, that there would be no more skin cancers because all of the education that we have and all the sunscreens, we wouldn't see another skin cancer. The melanomas would dry up, the basal cells, the squamous cells, but the reality is we're seeing even more now than we did before. So it means that something's going on, whether it's our immune systems that are being polluted by everything, whether it's the ozone layer that's breaking down, whether it's more time in the sun. I don't really know, but I know that skin cancers are a big problem, and sun is a big factor with the skin cancers. So I would encourage everybody to see your physician every year. If you've got a dermatologist, make sure you get a full body skin check, because if we catch the skin cancers early, we can save your lives, or we can do much smaller surgery to reconstruct the wounds. I don't have anything else really to tell you. I think that, you know, the world of skincare is going to be something that's just going to get bigger and bigger, and I think that we'll be able to do more and more with better quality products, and I'm really excited about the new technology that's coming out. So as this comes out, we'll be sure to bring it out in the medical spas and let everybody know. If we have your email addresses and we get something exciting and new, we'll certainly let you know. Has anybody seen what's the name of the new thing that pulls all the stuff out of your skin? The what? Anybody? Hydrofacial. Yeah. The hydrofacial we just brought in, it's doing is it really pulls out all the gunk that's in all your pores, and it's the next development in that area of skincare. So we'll try to provide the latest technology, the safest technology, and the best products for your skin.